How is optic neuritis linked to NMOSD? Imagine your vision suddenly becoming blurry or dim, and you wonder what could be causing it. One condition that often leads to such symptoms is optic neuritis, which is inflammation of the optic nerve. But sometimes, this inflammation is part of a bigger picture called neuromyelitis optica spectrum disorder, or NMOSD. NMOSD is an autoimmune disease where the immune system mistakenly attacks parts of the nervous system, especially the optic nerves and spinal cord. The connection between optic neuritis and NMOSD is quite specific and involves a unique immune response. In NMOSD, the immune system produces special antibodies called aquaporin for immunoglobulin G autoantibodies. These antibodies target aquaporin 4, a water channel protein found mainly on astrocytes, which are support cells in the brain and spinal cord, including the optic nerves. When these antibodies attack aquaporin 4, they cause inflammation and damage to the astrocytes. This damage triggers a cascade of events that leads to secondary injury of the nerve fibers and myelin, the protective covering of nerve fibers. This process results in more severe and widespread optic neuritis compared to other conditions like multiple sclerosis. In NMOSD, the inflammation often affects large segments of the optic nerve and can even involve both eyes at the same time. Sometimes, the damage extends into the optic chiasm, the part where the nerves from each eye cross. This extensive damage is due to the immune attack on astrocytes, which are crucial for maintaining the health of the nerve tissue. Because of this, vision loss in NMOSD-related optic neuritis tends to be more profound and recovery can be more challenging. Clinically, patients with NMOSD often experience sudden, severe vision loss, sometimes accompanied by eye pain. Optical coherence tomography, a special imaging test, shows that the retinal nerve fiber layer, which contains the nerve fibers responsible for transmitting visual information, becomes significantly thinner after an attack. This thinning indicates nerve fiber loss and correlates with the degree of visual impairment. Understanding this link is important because it influences how doctors diagnose and treat optic neuritis. When optic neuritis is associated with NMOSD, treatment strategies focus on suppressing the immune response to prevent further damage. Early diagnosis and targeted therapy can help preserve vision and improve quality of life. If you or someone you know experiences sudden vision changes, seeking prompt medical advice is essential, especially if other neurological symptoms are present. Always remember, each person's experience is unique, and personalized medical care is key.